They are tackling new risks. The streets are empty, businesses are closed as we all adapt to a new way of life. But much does remain the same. Officers are still out in their communities, fighting crime, protecting victims, and tackling antisocial behaviour. Some example in recent days: a man arrested in the Isle of Wight in connection with a £10 million importation of cocaine. 7 people arrested in London, including 2 at Heathrow Airport who were attempting to flee the country as part of an ongoing investigation into serious violent crime. 400 domestic abuse suspects arrested in 2 weeks in the West Midlands. And as criminals seek to take advantage of the virus, a man has been jailed for stealing personal protective equipment from a hospital here in the capital. And the less visible policing continues too. The work to trace child abusers, to track terrorists, and to protect us from cyber attacks goes on as before. And we're taking preventive action as well. The National Crime Agency are now taking down fraudulent websites and email addresses and have launched an online safety at home campaign, giving parents information to keep their children safe while they're likely to be spending more time on their devices. Initial figures from all forces show a 21% fall in overall crime across the last 4 weeks compared to the same period last year. That drop, combined with the commitment of our over 200,000 officers and staff across the UK, and the fantastic response from our volunteer special constables, who worked more than 222,000 hours in March, means that we are in a strong position. Keep reporting crime to us. Our teams are working round the clock to keep you safe and respond to emergencies. I particularly want to reinforce the Home Secretary's message to victims of domestic abuse or controlling behaviour. We will come when you call for help. And to abusers, do not think that this is a time where you can get away with this. We will still arrest, we will still bring people into custody, and we will still prosecute. Fighting the virus and protecting the NHS and saving lives is a national effort. And police have stepped up in their work alongside communities to support those hardest hit by the virus and to reduce the strain on the NHS and other care services. For example, 2 officers in London responded to a call where a 90-year-old woman had collapsed in her home. They gave first aid and recommended that she should go to hospital, but she was concerned because she didn't think she'd get to the shop in time to get milk. So the officers were able to get that milk for her and even helped her fix a broken light bulb when she got back. 2 other officers in Manchester responded to a concern for welfare call and encountered an elderly man who had no electricity, heating or food. The neighbourhood policing team, working with the local housing department and businesses, were able to put money on his meter and get his fridge fully stocked for the next day. And he now has a community contact in case he needs any further support. And officers in Cambridgeshire have been linking with a citizenship group to deliver tablet devices to vulnerable school children to ensure that they too can continue to learn at home while the schools are closed. And of course, we have new responsibilities given to us as part of the government response to the virus, which we will use carefully. In the UK, police gain their legitimacy and authority from the consent and support of our communities and the public. We are implementing the new regulations in that tradition of British policing. Since the new powers were introduced, officers have engaged with thousands of people, and in most cases, these people have quickly understood why it's important to follow the rules, and no enforcement has been necessary. Officers on the ground are telling me that they're seeing a great amount of support from the public, and indeed getting thanks for the role that they are playing. However, we have had a small minority of people who, despite our best efforts, have refused to follow the instruction, and officers have needed to use their enforcement powers. Next week, we will publish full data on enforcement so far, which will include this Easter weekend. But I can tell you now that using early data from 37 forces, that 1,084 fines have been issued in England and Wales up to Thursday, the 8th of April. So across all of those forces, that's an average of less than 84 a day. This shows that the overwhelming majority of people are abiding by the rules and are staying at home to protect the NHS and to save lives. And I think it also shows that our approach, engage, explain, and encourage, and only as the last resort to enforce, is working. In those few cases where officers or police forces have made mistakes in interpreting the new regulations, they have quickly sought to correct them and provide the necessary clarity. We will continue to be guided by principles of fairness, proportionality, and common sense. And I recognise that it's important that the public are able to judge us on whether we are keeping to those principles. So we will publish enforcement data every fortnight as we move through this crisis. This remains a very challenging situation for everybody, public and the police, as we all adapt to the changes that the country has seen. Thank you to all those officers and staff that are working this weekend and throughout these testing times. On top of the work that you do every day to keep your communities safe, you're now also helping doctors, nurses, and other healthcare workers to fight this virus and save lives. Police chiefs will continue to work with government, with staff associations and others to give you the guidance, the protective equipment and testing so that you can do your job as safely as possible. Thank you again to the public for your continued support. And my plea to you is simple, even in times of frustration and this good weather. Work with us, stay home, protect the NHS and save lives.
Thank you, Martin. I'll now hand over to Professor Powers.
Well, as we've heard, the instructions that we have all been given to stay at home, to avoid social contact, to maintain social distancing, are all designed to ensure that we stop the spread of this virus, we reduce the number of cases, and we save lives and reduce pressure on the NHS. And although I know that there is a lot of anger at the foolish few who think they can flout the rules, I would like to pay tribute to the vast majority, as you've heard from Martin, the vast majority of the British public who are clearly complying with the instructions that have been given. And we see that in many ways. As the first chart shows, we continue to see that the use of public transport has been very greatly reduced, and that is being maintained over the weeks of the lockdown. In the next chart, you will see that that is then translating from a stabilisation in the number of infections through to what you see, to the number of new cases. So as we see here, there has been a levelling off of the number of new cases. It does vary from day to day, but by and large, this is the sort of effect that we would expect to see from everybody following those instructions. And then in the next slide, you can see that that in turn is translating into a stabilisation, first signs of a plateauing of people who unfortunately need to be hospitalised or in hospital beds. You can see, as we said before, that there are more cases in London because spread in London has come first, but early signs of stabilisation in the rest of the country too. And then in the next chart, unfortunately, as I and others have said before, we are still seeing sadly high numbers of deaths. That will be the very final thing that will change and start to decrease. But we are confident that if everybody applies, follows the instructions, complies and follows the instructions that we've all been given, then that will begin to translate in the next weeks into a reduction in the daily deaths. Now, the NHS strategy through all of this has been to ensure that we always have the capacity to deal with the surge in numbers of patients with coronavirus. And that has been the case, and my colleagues in the NHS are working night and day around the clock to ensure that that headroom, that capacity, whether it's for people who are intensive care units, who need ventilators, through to people on general wards, that headroom is there. That also means that at the same time the NHS is open for business for people who have other illnesses. This weekend, for example, it's a bank holiday weekend. General practices are open, pharmacies are open. So if you are unwell with a condition that is not coronavirus, if you have symptoms of a heart attack that you're worried about or symptoms of a stroke, if you have a sick child who's deteriorating, if you're a pregnant woman and you're worried about the movements of your baby, then you should be accessing services in exactly the same way that you always have done, through 111, through GP services, or in emergencies through 999. The NHS is open for business and managing and capable of managing people with a wide range of illness. So, as I said at the start, the entire strategy is to ensure that by following instructions, something that we must all follow, we will see a reduction in deaths and we will protect the NHS. It is a bank holiday weekend. It's a time of year when typically we would be celebrating or getting together with relatives and close friends. But I'm afraid this year it has to be, for all of us, a stay-at-home Easter.
Thank you, Professor Powers. Now, I think we're